House Bill 2360. Representative Marshall, for what purpose do you rise?
Mr. Speaker, I move to commit House Bill 2360 to the House Health and Wellness Committee.
It has been moved and seconded that House Bill 2360 be committed to the House Health Care and Wellness Committee. Remarks, a good member from the 2nd District, Representative Marshall.
Thank you, Mr. Speaker. This bill considers albuterol use, which is a pharmaceutical drug, specifically for our children, and expands scope. Permission to read.
Please proceed.
So the House Health Care and Wellness Committee's jurisdiction includes provision of physical and behavioral health care services, as well as scope of practice of all healthcare professions. House Education Committee jurisdiction is considering issues relating to kindergarten through 12th grade education. I personally believe that it would be better to have this bill considered by the committee that deals with healthcare issues, specifically scope of practice enhancements as this bill directs. So I would urge that we adopt this motion to recommit. I also know that there are concerns because we are a past policy cutoff, and we couldn't amend that cutoff resolution here in this body, Mr. Speaker, so that we can have this bill properly considered. So I would urge your support of this motion.
Good member from the 2nd District, Representative Marshall.
Thank you, Mr. Speaker. And while there are members that serve on both committees like myself, there are significant stakeholders that were not there to testify, specifically several medical agencies, Department of Health, State Board of Health. We did receive input from the School Nurses Association, but that was one of many. And as you and I both know, when we have several stakeholders in the room, there is a variety of concerns that can be addressed through the process. So again, I would urge your support of this adoption, or of this motion.
Representative Marshall.
Thank you, Mr. Speaker. I do very much support the underlying premise of this bill. We all have a desire to ensure that children in respiratory distress get good care, and good care immediately, specifically life-saving measures. My concerns are not with whether or not a child in distress from asthma has a tool available to them. The concern is with what happens after this emergency tool is used, as well as what is the level of training in these schools. Not all schools have RNs, registered nurses. Some of them have different levels, not at the RN height, but a little bit less training. However, they do go through a program. Also, there's going to be some oversight. So I understand that, we're looking at expanding scope for these nurses. However, we're talking about giving albuterol to children who do not have a diagnosis from a medical provider, who has the skills to actually diagnose and provide an intervention. In the nursing pathway, there are certain areas that they can do this, and asthma is not one that has been routinely across the spectrum delegated to nurses to make a diagnosis and provide the intervention. And doing this in our schools to children and then notifying parents afterwards, I do not know if that is necessarily the best idea. And not having close prescription as far as the follow-up, ensuring that this child does not just get albuterol and go back to class, but making sure that the child gets the albuterol and has a 911 activation for the respiratory distress, is transported, gets a proper medical evaluation, and then goes back to class. I think there are significant problems in this bill in its current form, and I cannot support it right now. However, I understand why some members may push it forward, and I would urge you to join me in voting no.